Yeah, and so that's the biggest issue with multiple sites is that you have to be physically present if you're doing professional service. And that's the problem. You have to be physically present if you're doing a professional service. This is an ancillary service, and that's what differentiates it. So you don't need the physician there. Now, the physician can interpret the test and bill additional for professional service, but that's not in the money that we're talking about. If you have 1,000 patients, the practice generates about $844,000 a year. They keep 60% of that, we get 40%. If they want to add lifestyle coaching, they'll generate another $1,600 to $1,800 per year per patient. And we recommend using an RPM company, and they'll usually get a 50-50 mix. As in terms of the compliance, step 1 and 2, there can be no transfer to the practice because this is all laboratory testing. Now, you're going to gain a bunch of data from step 1 because we're going to do a review of systems. We're going to do blood pressure, heart rate. We're going to do all of this stuff that we're going to gather information. We take that information and we enter it in our system, and we enter it into the physician's system so that there's a mirror image that shows that on this day, this technician measured this, and this is what the review system showed. So if you're doing a HEDIS score later, if you're doing an annualized wellness, you can reference back to that because you've already documented it. If you do this and you're doing MIPS scoring, you've captured most of your MIPS, probably 90% of your necessary MIPS in step 1, which is your blood pressure, pulse oximeter, and BMI. You've captured 90%. You've actually just become more compliant than 99% of physician practices in the US because you captured a bunch of data that they were supposed to capture, and they never measure height. They just take the patient's word for it. How tall are you? Well, I'm 5'8". All right, and they write that down. They don't measure the height. And for us, it's critical to have that accurate because otherwise everything that we're doing is going to be wrong. And so we have to be dead on. You can use this for your MIPS scoring as well. And then step 2 is to get those biologics and get the results of that. And that gets entered into your record. So now you have confirmed your index of suspicion, you got your biologics, and it's all in your record now. Step 3 is the Measura testing, and the results of that 30-page report goes in your record, plus the risk assessment. And if you were ever to do a HEDIS score, you'd probably just gained about 6 diagnostic codes that you didn't have before on that patient. Because now you know what their vessel elasticity is. Now you know what their heart rate variability is. Now you know what their risk factor is for Alzheimer's. Now you know what their risk factor is for likelihood of having arthritis 8 years from now. See, the thing is, we can pre-identify which knee is going to go bad 8 years before the x-ray changes. 8 years. We can tell you which knee. If I did a sample out of your knee with fluid and I looked at it, or if I did a blood sample, I'd know that something's going to go bad in 8 years. It's going to be arthritis, but I can't tell you which joint. But if I looked at the different joints and I did a sample there, I could tell you, hey, it's going to be your left knee that we're going to have to replace in 8 years, because that's what orthopedics is. Orthopedics is taking care of problems that are degenerative. These aren't load-bearing joints causing all their problem. Unless it's traumatic, most of the issue with osteoarthritis is metabolic.